This is Newsmax TV. I'm Ashley Martella. The controversy over the Democrats' health care overhaul that passed without a single Republican vote is back in the news. President Obama stirred up a hornet's nest this week when he appointed a very controversial doctor and Harvard University professor Donald Berwick to run Medicare and Medicaid. In making a so-called recess appointment, he bypassed the normal Senate confirmation process. In an interview published last year, Berwick said the decision is not whether or not we will ration health care. The decision is whether we will ration with our eyes open. And in 2008, he said wealthy individuals must redistribute their wealth to those less fortunate for health care funding. He also told a British audience that he opposes free markets. Dr. C.L. Gray joins us by phone now to discuss this. He's an internal medicine physician in North Carolina. He also founded Physicians for Reform, a nonprofit organization whose goal is to find solutions for American health care. The website is physiciansforreform.org. Welcome to Newsmax, Dr. Gray.
It's great to be here.
As a practicing physician, how do you feel about having a person overseeing Medicare and Medicaid and the Children's Health Insurance Program who apparently is comfortable with rationing health care?
Yeah, especially in light of the recently passed legislation, I think this is a huge misstep for the government if they're trying to actually serve patients. If this is about health care and patients and improving the system for patient-centered health care, I don't think that's where this road is going to end.
Democrats on the campaign trail always love to warn seniors that Republicans are out to cut their Medicare. But in the end, it was Obama and the Democrats that actually did it. A cut of over $500 billion. Your thoughts on that, please?
Well, it's actually closer to $750 billion rather than the $500 billion because they had to skip the, quote, doc fix. They were actually planning on cutting physician salaries by 21% in order to claim they, quote, reduce the deficit. So they need to come up with about $750 billion to get back to where we were.
Will Obamacare affect your practice at all and the patients you treat and the insurances you accept?
Well, yes, it will. And as I talk to the physicians in my community, and there's 2 hospitals in the community, it's a sort of a small to mid-sized town. There's a lot of physicians actually having to borrow money to make payroll after this last Medicare cut. They passed a temporary fix, but it's going to be back again in December. There's physicians looking to leave medicine, and I'm running a survey, and there's about 60% of the physicians strongly opposed, but another 20% oppose the recent legislation, and another 15% that are looking to leave medicine early because of this legislation.
In a June 22nd article posted on AOL News, you wrote that seniors are losing access to Medicare doctors. And in an article earlier this year, you wrote that Medicare is already rationing care. Please briefly summarize the point you were making.
Well, a lot of it is Medicare actually is reimbursing just barely the cost of delivering care. To pass the legislation, they had to make enormous cuts to Medicare to get the thing through and tell the people they were reducing the deficit. As they ratchet down on physicians, more and more physicians are deciding it just isn't worth or they aren't able to care for Medicare patients. For example, in Texas, they recently released data. Prior to 2002, between 1 and 3 docs per year left the Medicare system. In 2008, I think it was 151. 2009 was 135. 2010, we're on pace to lose 200 physicians just in Texas that are leaving Medicare altogether.
What do you make of the AMA's endorsement of Obamacare?
That's disappointed an enormous number of physicians. The AMA initially only represented about 17% of physicians, and it's very hard to get data on what that number is now, but personally I know a lot of physicians that have sent back their membership. And we're needing another voice to speak for patients and working physicians, and not the academic elite.
The pharmaceutical industry also became a cheerleader for Obamacare after drug lobbyist Billy Tolson managed to get some goodies in the legislation like subsidies, mandates, and a 12-year government-enforced monopoly on complex drugs, something unprecedented. Now, Big Pharma is on a pro-Harry Reid TV blitz in Nevada for his re-election bid. Do you think there's a chance the pharmaceutical industry is keeping the price of some prescriptions artificially high out of outright avarice?
Well, under the legislation, there is going to be an enormous amount of money pumped into the system. It's about $1 trillion bill, a lot of which was going to pay for medications. And even though the pharmaceuticals put out money for advertising, they're recovering an awful lot of that money through increased spending on drugs. Now, I'm actually very much in favor of the pharmaceutical industry and the drugs they make, because that's how I take care of my patients. I practice hospital medicine, critical care. Without these drugs, a lot of the patients I care for would die. But I think there's an awful lot of politics behind the scenes that led to that endorsement. And again, it wasn't based on patient care.
What about seniors who are on a very limited income, perhaps just Social Security, who can't afford the price of these new drugs that are astronomically high?
Yeah, and I think seniors, what I'm trying to develop is a platform for physicians to work with patients, to work with business owners, to come up with patient-centered, fiscally responsible reform. Unfortunately, I feel like Washington threw seniors under the bus to pay for this bill. There are other solutions, insurance reform, tax reform, tort reform, that can be enacted to actually save Medicare, because right now Medicare is bankrupt, and this bill did nothing to solve that problem. In fact, they only made it worse.
Would you like to see the entire health care reform law repealed, as 60% of voters nationwide favor, according to Rasmussen?
If that were politically possible, yes, I'd be very much in favor of repeal, but not just repeal. There has to be reform to our system, but it can be replaced by, and I've outlined a series of 6 steps to provide some fiscally responsible, patient-centered reforms that actually return power to patients and physicians in a fiscally responsible fashion, rather than handing over power to Washington.
Do you think the constraints, restrictions, taxes, mandates, and penalties in Obamacare will eventually cause a shortage of medical professionals, especially doctors? We're losing cardiologists as we speak in my own hometown. And I don't know how more personal it gets than that. Again, his website is physiciansforreform.org. Thanks for joining us and sharing your thoughts with us, Dr. C.L. Gray.
Yeah, thanks so much for having me.
And good luck with the website. And thank you for watching Newsmax TV.